Nearly all of the 301 patients cared for by Ballad Health following a carbon monoxide release at Milligan University have been discharged. That's according to Ballad. It was discovered at the Steve Lacey Fieldhouse yesterday. Ballad said earlier today that fewer than 5 patients remain under care in medical facilities. The incident has raised the question on what you should do if you believe you've been exposed to carbon monoxide poisoning. News Channel 11's Haley Pitcher sought to find out. Haley?
Well, Casey, luckily this gas leak was discovered before any severe symptoms that we know of were shown from those impacted. However, carbon monoxide can be a silent killer if symptoms aren't noticed and treated fast. I spoke with Sullivan County's regional health director on what those symptoms are and how exposure is treated. Carbon monoxide is an odorless, colorless, and toxic gas chemically created by the element carbon experiencing incomplete combustion. Dr. Stephen May with the Sullivan County Regional Health Department says the gas binds to hemoglobin in the blood and reduces blood's ability to carry oxygen to the body's organs.
When it does, oxygen is displaced, cannot be used correctly, and basically you asphyxiate. You smother to death because you don't have oxygen, but it's not smothering from the lungs, it's smothering at a metabolic level.
Symptoms of carbon monoxide exposure include headaches, dizziness, upset stomach, and chest pains, symptoms often described as flu-like. The amount of exposure it takes to turn the gas lethal are anywhere from a matter of minutes to hours or days.
The greater the concentration, the shorter the length of time. If you go into a room that's fully saturated with carbon monoxide, you can basically smother in 6 to 8 minutes because the oxygen is completely displaced. Low levels can take much longer.
As the winter weather impacts our region, there are many more risk factors for carbon monoxide inside our own homes.
We're using alternative forms of heat, kerosenes, generators, all types of carbon-based fuels to keep warm. And yet our houses are tightly closed up. They're not allowed to ventilate. And as a result, carbon monoxide poisoning can happen very rapidly.
Symptoms of exposure are frequently confused with other conditions or even dismissed. Dr. May says to think through the symptoms you're experiencing and the situation you're in.
One, is there a source? Number 2, I would want to be sure that if there is a source, I have a carbon monoxide detector in my home. And then if I have those symptoms, the detector goes off, I know I've had carbon monoxide exposure.
Ballad Health said in a press release they will give an update on their response to the exposure tomorrow morning. Back to you, Casey.